Hi everyone, welcome back to another episode of Be a Nurse They Said. My name is Lainey and I'm so happy that you're here. If you haven't gotten a chance, my last video was on how to deal with difficult coworkers, and this is part 2 of that. Now we're going to talk about how to deal with difficult family members and visitors when they're in the hospital. Some of these tips are going to be similar to the ones I talked about in the previous video, but some are going to be different. The most important thing to keep in mind when you're dealing with difficult family members and visitors is that they are at a very vulnerable time in their life as well as the patient that you're taking care of. Having been on the family side of a patient in the hospital and the nurse side, it is super difficult to be the family member having a loved one in the hospital and sick and see them in such a vulnerable state. So not only is it overwhelming and stressful for the patient, it's overwhelming and stressful for the family members and the visitors as well. So here are my top 7 tips on how to deal with difficult visitors and family members in the hospital. Number 1, stay calm and professional. Like I said, they are all in a very vulnerable state. You don't know the emotions that they're going through. They don't know what's happening with their loved one. So it's very important to stay calm and professional and remember that you're there to do a job and take care of the patient. Watch your body language. When family members see you in the room with your arms crossed or your eyes rolling or you looking away and not paying attention, they're not going to think that you're caring for their loved one. They're going to think that you don't want to be there and you really don't care to take care of them. Also try and avoid emotional reactions. If they say something that you're not so happy about, before you just respond with something you may regret, take a deep breath, take a step back, and then respond. Because like I said, they are very overwhelmed and they are very stressed. Number 2 is to try and understand their behavior and not take it personal. They are 99% of the time not mad at you. They are just upset at the situation and what's going on. They don't want to see their loved one laying in a hospital bed having to be taken care of and sick and not know what the future holds. So you really can't take anything they do or say personally. It's very important to practice active listening. Make sure that the family member feels heard and you understand what they're asking you. You can respond with something like, "This might be very difficult for you. I know this is difficult for you. I understand that this is hard for you," just to make them understand and know that you are listening to them and their concerns. Number 3 is to use clear communication and practice honesty. Don't use any medical jargon because a lot of times the family members and the visitors don't have a medical background, so you shouldn't be using all sorts of medical terms with them. Don't say hypertension, say high blood pressure. Use things that they understand. It's also important to be very transparent. Explain what you're doing. If you go in to do a dressing change, tell them what you're doing. Don't just rip the sheet off, rip the gown off, start ripping the dressing off and doing your thing. Walk in, introduce yourself, explain what you're going to be doing so that way that the patient and the family and the visitors feel more comfortable. Number 4 is to set boundaries. It's important to be firm, but also be polite. It is okay to address inappropriate behavior. If they're yelling at you and possibly cursing at you, then it is okay to say, "I think you need a minute. I'm going to step out and I'm going to come back and we'll try this again." It is okay to do that. It is also okay to bring hospital policies into it. If they're doing something you're uncomfortable with, especially if it's against your hospital policies, it's okay to reference those policies and show them that is actually against the hospital to be doing what they're doing. Number 5 is to involve the care team. If you need to, you can get backup. If it gets very escalated and you feel like you can't handle it anymore, it is okay to get the charge nurse involved, to get the house supervisor involved, and even get security involved if it is necessary. If needed, you can involve the patient advocate. If something is going on with the patient and you can't seem to get to the bottom of their problem, you can involve the patient advocate for more support. They also might want a doctor's presence. If you're a nurse and you're watching this, you probably understand that you can tell the patient something 15 times and they won't listen to you. But if the doctor comes in and says the exact same thing, they will listen. And this is absolutely nothing against doctors, nothing against patients or anybody, but that's just the reality and how it is. So if you need to get a doctor involved and actually ask them to come into the room and talk to the patient and the family members, that's okay too. You may need to have a family meeting, get the doctor, case manager, social work, whoever needs to be involved all together in one meeting. That way everyone's on the exact same page, because a lot of times there's just misunderstanding because people aren't communicating enough. Number 6 is to offer solutions. You may not be able to get to the bottom of their problem right away, but you may be able to offer some alternatives. So you can't do this, but I can offer you this. We can't do that, but we can do this. It's important to offer them alternatives so it seems like they have a voice and they have a choice in their healthcare. And number 7 is to document. Keep track of any issues or interactions that you have that you think may escalate into a larger situation. That way, everything is written down and there's no he said, she said, me against you, him against her, whatever it may be. It's very important to protect yourself because at the end of the day, you're protecting yourself and you're protecting your nursing license, which you worked entirely too hard for to have taken away from you. Unfortunately, you will come across dealing with difficult family members and visitors, but it's very important to stay calm, stay professional. Remember that they're in a very vulnerable state and they're probably not mad at you, they're mad at the situation. So try these tips. Refer back to this video if you're dealing with a difficult family member or a visitor while in the hospital. Just try and put yourself in their shoes because you really never know what they're going through. Thank you so much for watching. I hope you enjoyed this episode of Be a Nurse They Said. Be sure to subscribe to my channel, like and comment on this video and tell me what you thought. Also be sure to check out my TikTok and my Instagram pages, Be a Nurse They Said. And don't just be a nurse, be amazing like I know you all are, and I'll see you next time.